The Maryland Department of Health, Developmental Disabilities Administration, Self-Directed Services Training Series. Module 11, Vendor and DDA Provider Overview and Billing, updated October 2025. This training module will provide you with an overview of vendors, DDA providers, and billing. This training is a summary with important information on this topic. More information and requirements are found in the Medicaid Waiver Program applications, laws, regulations, guidance, and policies. The most updated information regarding self-directed services is published in the Self-Directed Services Policy and Manual that can be found on the DDA's website. Anyone paid to provide a Medicaid waiver service, including vendors and DDA providers, is considered a Medicaid provider, subject to all laws and regulations associated with being a Medicaid provider. In order to be cleared for work by the Financial Management and Counseling Services provider and receive payment for services, all vendor and DDA provider employees who directly support the participant must meet all qualification requirements as listed in the applicable federally approved Medicaid waiver program. The Financial Management and Counseling Services provider cannot pay for services rendered by a vendor or provider who does not meet all requirements. Criminal background checks are required for all direct support staff, including vendors and DDA provider employees who work with someone who self-directs. The requirement also applies to independent contractors or self-employed individuals. Vendors and DDA providers run and pay for the criminal background check for any employee who directly works with the participant. All vendors must share the results of the criminal background check with the participant and their financial management and counseling services provider. Providers must provide a copy of their active license or certification to the participant and their financial management and counseling services provider. DDA-operated Medicaid waiver programs allow for two types of criminal background checks. A Maryland state-only criminal background check via fingerprinting with the Maryland Department of Public Safety's Criminal Justice Information System, or a national criminal background check through a private agency with whom the vendor agency contracts. The criminal background check must include court or other records in each state with the participant employer knows or has reason to know the eligible employee or contractor worked or resided during the past 7 years. The type of background check is determined by the vendor and the DDA provider as negotiated with the participant. Child Protective Services background checks are required for any employee of a vendor or DDA provider that is hired to work with the participant under the age of 18, unless otherwise authorized by the DDA. Vendors and DDA providers run and pay costs associated with checks and share the results with the participant and their financial management and counseling services provider. In order to be cleared for work by the financial management and counseling services provider and receive payment for services, all vendors and DDA providers working directly with the participant must meet all qualification requirements as listed in the DDA-operated Medicaid waiver program. First aid and cardiopulmonary resuscitation certificates. First aid and cardiopulmonary resuscitation certifications are required for any employee who works directly with someone who self-directs. Training must be completed in person or through a hybrid model that includes an in-person component of the training. Online-only first aid and cardiopulmonary resuscitation training does not meet the requirements. Emergency Medical Technician Certification, EMT, can meet this requirement. The participant may negotiate any other training as desired. All training is paid for by the vendors and DDA providers. Anyone paid to provide a Medicaid waiver service is considered a Medicaid provider, subject to all laws and regulations associated with being a Medicaid provider. In order to be cleared for work by the financial management and counseling services provider and receive payment for services, the licensed or certified provider must provide a copy of their active license or certification to the participant's self-directing and their financial management and counseling services provider. Vendors and DDA providers are responsible for making sure all employees initially and continuously meet the qualifications of the Medicaid waiver services provided. Vendors and DDA providers are both paid by issuing invoices to the participant. The financial management and counseling services provider cannot pay any vendor or provider invoice that does not include the name of the participant, vendor name, the services rendered as authorized in the PCP, dates the services were rendered, start and end times of the services each day, number of hours or units for each day broken down by the quarter hour, names of the direct support professionals who provided the services during each shift, a description of tasks completed by the vendor during their shift, and total amount charged. Invoices must be approved by the participant or their designated representative in the method that the financial management and counseling services provider allows, including signature. Sample and template invoices are available on the DDA website. Effective January 1st, 2025, all invoices must contain all of these elements in order to be paid by the financial management and counseling services provider. Invoices must be approved by the participant or their designated representative in the method that the financial management and counseling services provider allows, including signature. Invoices must be submitted as per the applicable financial management and counseling services providers' policies and practices. Sample and template invoices are available on the DDA's website. Providers and vendors work directly for the participant who hire them. Non-payment inquiries must come at the direction of the participant. Providers and vendors shall never contact financial management and counseling services without the participant included. It is important to note that the provider and vendors, including support brokers, may never inquire to a financial management and counseling services provider regarding more than one participant at a time. This slide includes useful resources. In summary, all vendors and DDA providers must meet the requirements of the Medicaid waiver services they provide in order to be paid, including initial criminal background checks, child protective services checks, if working for a minor, training requirements. Vendors and DDA providers must provide documentations to participants and financial management and counseling services providers to show they meet the requirements. DDA providers must provide their license or certification. Invoices must meet all requirements. Invoices must be approved by the participant.